So I saw on Facebook today a post which was actually a really interesting post, and it's on a plantar fasciitis group, and I thought I would share the question and then give a response to it. So the question is, and forgive me, I'm just reading it off the iPad: has anyone's foot pain changed from a bruised to a burning sensation? This has happened to me after returning from a holiday. It's burning to the point where some of my stretches are feeling really uncomfortable, so I've stopped through fear of doing more damage. This is actually a really common thing, and it's where basically you have a symptom which is bruising of the heel probably, and that's kind of that sensation comes from the plantar fasciitis, and then you then develop something that goes alongside of it. And in this instance, where you're getting a burning sensation, depending on which bit of the foot it is that's burning, may imply that there's actually another thing involved, such as a neuralgic component, i.e. a nerve component. So if you're getting burning along the outer border of the foot, so along the little toe side, you might have a trapped nerve somewhere in the arch of the foot, which basically there's a nerve which comes down from the inside of the ankle bone, and then it runs along the arch of the foot, and then it splits into two parts, supplying the inside and the outside of the foot. So the inside on the big toe side and the outside on the little toe side of the foot. So if you're getting burning going down one side of the foot, then it could imply that that nerve itself is a bit trapped. However, along the arch of the foot, there's this nerve and it splits off into two, but it actually, on the bit that goes off to the side, so it kind of comes down the arch of the foot and then across to here, you've then got a bit, as it comes across, it then shoots backwards the nerve and it supplies the heel bone, so, or the area under the heel. So when you then consider that you've got all these structures around here, lots of muscles and stuff that could be squishing that nerve, that could cause a burning sensation. And actually, when people talk about it hurting more when they stretch, quite often there's a nerve or neural component. The reason being that the nerve kind of gets caught by all of the structures surrounding it, all the muscles, and they hold on to it. And then as you're stretching, the nerve isn't moving as smoothly as it could. So quite often in this instance, what's needed is looking at some stretching for the soft tissue and some mobilization for the soft tissue, so things like massage, but also looking at something called neural flossing, which is where you very delicately try to move the nerve through all the structures in the local area that are irritated. So another thing that's similar is piriformis syndrome. You try to just get the nerve very gradually moving through those structures, kind of like a rusty hinge where you might squirt some WD-40 on it, give the door a bit of a move, squirt some more WD-40 on it, and then just try and get that oil into the hinge. You're just trying to get the nerve shifting very gradually, letting it just loosen up from the bits where it's a bit caught up.